The provincial government has announced plans to deregulate the practice of traditional Chinese medicine. Government officials say this will allow more people to enter the field, but those in the practice say that it's a terrible idea that not only affect practitioners, but also patients. Daniel Canner has been practicing traditional Chinese medicine and acupuncture for over 18 years. He worries deregulating the profession could put patient safety at risk.
You wouldn't go see a doctor or a dentist and let them put needles in you if they weren't licensed and regulated. So the same holds true with acupuncture.
Canner says he was horrified to hear the Ford government was considering this new Bill 88, which repeals the Traditional Chinese Medicine Act. That act gave the College of Traditional Chinese Medicine Practitioners and Acupuncturists of Ontario regulatory licensing and enforcement authority. The new bill would place the college under the control of an administrator tasked with winding up its operations.
The college isn't there as a barrier to practice for people to practice TCM. It's intended to provide a set of minimum standards and guidelines to ensure that only those who are qualified to practice acupuncture are permitted to do so.
We inherited a broken system, and it really prevented anyone speaking Mandarin or Cantonese from really writing the exam in that. So we're trying to fix the problems that we inherited.
The province says the proposed plan, which was contained in recently tabled labor legislation, would allow more people to work in the field. The Canadian Association of Acupuncture and Traditional Chinese Medicine says they support the bill, saying this will help strengthen the bond between Western and Chinese medicine so that patients may receive well-rounded care.
The Chinese medicine with Western medicine is totally different. Western medicine is a research. TCM is a practice. They use experience, and they use 5,000 years. They have 5,000 experience.
But some practitioners don't agree. A petition has been circulating online calling for the Ford government to stop this proposed plan, citing the alternative medicine not only involves on-set practice, but also knowledge of anatomy, which must be regulated for safety of patients. That petition has over 24,000 signatures.
Our shock really has come from the fact that there was no consultation about this sudden change. Our ask has always been, remove the schedule from the bill. Let's have some meaningful consultation on what this change really means.
How do you expect this could affect the general public?
So this is a safety issue for the general public. Again, having the college ensures that if the acupuncturist or the TCM practitioner that you're going to see in Ontario has met the aforementioned regulations and guidelines set by the college. The mandate of the college is to protect the public and its patients. So if just anybody is allowed to set up shop and start doing acupuncture, this is potentially very dangerous.
Healthcare Minister Christine Elliott says that the proposed plan would transition regulation to the Health and Supportive Care Authority, the same authority that regulates personal support workers. Nakhavoly, City News.